Elevate TV, advancing kingdom lifestyle.
Good morning, and this is the Morning Digest Wednesday edition, and today we have a full house. We'll be discussing radiography and the matters going around it. And today we have a great discussion, because if you don't know what these people do, you will be able to understand today. So as usual, this is Elevate TV, advancing kingdom lifestyle. We want to ask you to pick the link right now on Elevate TV, right? Pick it out on Elevate TV right away, and then share it on all your links on WhatsApp and on Twitter, on YouTube. You will be able to get it. And also, you are welcome, those of you on Elevate Television. This is the Morning Digest Wednesday edition, and I'm Moses Miruri, and today I have a great big house from the Society of Radiographers in Kenya. So guys, this is Elevate TV. Karibuni sana. And I want to begin our introductions from the far right.
Okay, thank you, viewers, for those who are following us online and live now. Thank you for participating in this show, and thank you, Elevate TV, for hosting us. My name is Anthony Mamati. I'm the former president, Society of Radiography in Kenya. I'm a radiographer and also a health economist and policy expert. Thank you.
Welcome.
Thank you very much for giving us this opportunity to be here, and you thank the Elevate TV family for giving us this platform to at least to speak on what we do as a profession. My name is Amudi Mayenga. I'm a senior radiographer at Aga Khan University Hospital, and I'm pleased to be here. Thank you very much.
Yes, sir.
Thank you. Thank you, viewers, for following us on this great discussion. Thank you, Elevate TV, for giving us this opportunity to speak to Kenya. My name's Samuel Karanja, radiographer, and I'm a director at Diversity Group Limited.
Well, you've heard for yourself. They've given us their names, and we'll be going right into it. And I want to ask Mr. Anthony, radiography. You know, when you go to hospital,
Yes.
there are all these names.
Yes.
Radiography, you know the name radio has a lot of connotations in the mind. So
Yeah.
please explain what this is all about. What is a radiography?
So that's an interesting question, and it's a question that a lot of people also ask. What is radiography and what does it entail? Radiography, primarily for our viewers and for those who have got students or who are interested in pursuing this, because we are discussing about opportunities in radiography, is an art and science of using ionizing and non-ionizing radiation to diagnose, treat, and for research. Now, that is the scientific description, but for the layman way of putting it, we use radiation to diagnose diseases and treat them.
Wow.
When we say to diagnose, we start from the lowest continuum of doing general x-rays, whereby when you get a fracture, mtu akiendesha boda kwa bahati mbaya apate ajali, then now they go to hospital. For us to determine where that fracture is, we use x-rays. It goes up to the whole continuum of finding out chronic diseases like cancer and treating them. And even now, it has advanced to levels whereby certain diseases in the vessels, in the blood vessels, like clot, you can go in with a special tube or a stent and you open it up, then somebody lives a normal life. So it's primarily to use the radiation to diagnose and up to the levels of treatment and all that pertains into it. So that is primarily what radiography is.
Wow.
Yeah.
You know, you've used a lot of language.
Yeah.
I'm just processing it in.
Yes.
But I'm glad that I'm able to know that. You know, for us, or maybe for many, and I'm going to ask for those many, is what we used to say, ameenda kupigwa picha.
Yes, exactly.
Exactly.
Ameenda kupigwa picha.
Yeah.
So that's it, eh?
Yeah.
It's actually picture.
Kupigwa picha.
Yeah, and then we actually call it the eye of medicine.
Wow.
Because in the whole medical practice, there are only two departments that find out what disease you have.
Yeah.
That is laboratory or radiology.
Oh.
The only two departments.
Wow.
When you are sick, for people in healthcare to know what you're suffering from, it's only either they do lab works or they do radiology.
Yes.
So in our context, we actually see what happens in you. When we say about that, there's a joke we use within our caucus. We don't say until DNA sets us apart. We say until ultrasound sets us apart. Because in ultrasound, we can literally see huyu ni mtoto wa Moses. We can see 3D inside the body, and we can see the features. And you can claim ownership as early as possible before the baby comes out. So that's usually a joke within the industry. But we literally see the disease process.
Until
Ultrasound sets us apart.
sets us apart.
So even as he says, maybe just in addition, in medicine there are two branches that we are talking about. There's diagnostic and there's the therapeutic. So in radiology we fall under diagnostic. Just as he says, there's lab and there's radiology. So that falls under the section of diagnostic, but there's another section of therapeutic. That's the treatment. Yeah.
Tell
Moses,
me, sorry.
It's very crucial to know that in everyone's life, you'll have to go, in one way or another, you'll have to go through an imaging session.
Oh.
In one way or another.
Yes. The other day I slipped on a staircase. I ended up in one. Just to give us my friend Moody, your normal day, how does it look like? Can I call it a lab or in your room?
Yeah, you call it we call it a diagnostic radiology lab,
Okay.
or a radiology department. One thing I want to tell you that I love what I do. If I was told to choose again another profession, I will still choose radiology. I will still choose radiography. Even if I do politics, I will add radiography in it.
Wow.
So my normal day is one of the lines that I've taken so much of interest is ultrasound.
Okay.
Because I also have a subspecialty in ultrasound.
Okay.
So most of the time what I do is I do ultrasound imaging most of the time. I also do general radiography, X-rays, and CT and MRI. But one of the major things that I love doing is ultrasound, because ultrasound has come to revolutionize imaging a lot, especially in terms of obstetrics, when your wife is pregnant and you want to know how many days this pregnancy is, and you want to know if they're twins, you want to know if they're 1, 2, 3 or triplets or quadruplets.
Nitashinda hapo bwana.
Leo akawa namba gani, anakaa namba gani. You want to know the sex of the baby. So that's what I do, and I love doing it, because from it we can know whether the baby is normal, if there's an abnormality. We can always try to advise the obstetric and gynecologist on what to do next, just after doing the imaging. So from the point where I sit, I love doing it, because I can see what is developing in the womb of the mother. I can reassure the mother that if there's a problem, like my mother comes to me, there's bleeding, there's abdominal pain, there's threatened miscarriage, we're able to look at the baby, do the scan, and ascertain, is this pregnancy still okay, or is there anything that we need to do in terms of how do we manage this patient. So from what the report we are going to write, we are going to advise the doctors and the physician on how to manage the case.
You know, the way you're discussing this matter seems like you can't. I think a hospital is never complete without this one, Anthony. You
Definitely.
cannot do without it.
Sure, it's you see, for any doctor to make a clear plan,
Yeah.
it's like we are the architecturers who give the builder what to do. So for any doctor to make any clear management, even the diagnosis itself, you really need radiographer to give you the clear image and a good image, and even the guidance. You realize that some of the areas that we specialize in are directly involved in therapeutic, like my colleagues have said, that is radiotherapy, and some even in theater. So when you're having a surgeon operating a patient, he really need to know how deep should I go so that I could fix this fracture. What are the measurements? Is the fracture fixed? Is it complete? Those are things that will, they are real time helping you to plan and manage the patient.
Let me ask, let me just ask this one. Anyone can answer. What do I need to become a radiographer? Ni masomo gani hii?
I mean, that's a good one, because after saying all these things, people are like, then I think I need to do that.
Yeah.
Yeah, I think I need to do that.
I'm ready to change.
Yeah. So to become a radiographer, it's an interesting process, because first for those students who are in high school and those who've got people and who are listening in and getting interested, then it means that they'll need to do the 3 sciences. The biology, which is concerned about human life. Then we've got physics and chemistry, because all those are important underpinnings towards the practice. Then we've got language. You know, the other day Waziri said, but what we come to also say, not disputing Waziri's remarks, maybe the questions are not the ones we are aware. Yeah. So again, language is key. Then that's the cluster combination.
Okay.
Basically the 3 sciences and language. And maybe by extension you might want to know, then where can we do it if we've got these qualifications?
Yes.
Currently in Kenya, it's offered in 2-tier at diploma level and degree level, and soon we've got several masters and coming up.
Wow.
At diploma, we've got Kenya Medical Training College, which has been doing this training for almost 50-60 years.
What?
Here in Nairobi, it has expanded to satellite campuses. We've got in Nyeri, we've got in Machakos, Eldoret, Kapkatet, Kisumu, Mombasa, and Machakos. Then we've got the degree tier, which is at Jomo Kenyatta University of Agriculture and Technology. People might wonder, why is it a closely guarded secret? Because radiography deals with very, very dangerous component of life, radiation.
Wow.
So it's not something that can be mounted or started anywhere, anyhowly. Because it's closely watched by International Atomic Energy Agency, closely watched by United Nations, because of the likelihood of danger that comes as a result of careless use of radiation everywhere. And that's why it's a closely guarded and monitored training process, so that it's not also abused for negative effects. So that's why, again, when we come out as professionals to speak, we guide people towards the safe use of it and peaceful use of it.
Wow. Safe and peaceful.
Safe and peaceful.
Let me ask you, Bwana Mudi, a patient has come into hospital, because we're going to deal with other issues. I just want us to clear these ones. I have come into the hospital. I need to see a radiologist. And what should I expect? What should I expect? So that at least, you know, very, very, very careful. You know, when you go into a hospital and you're told go, they normally say, what should I expect? I've seen, and I would want you to address this one, sometimes they even inject.
Yes, definitely. So I think that's a good question. And one thing we need to know is when you come to radiology department, just as my colleague has said, we are dealing with dangerous ionizing radiation. So there are a few things that maybe you're going to be told. Maybe you'll find some alamas on the ukuta. If you're pregnant, inform the radiographer. It's because we really want to know there is a protocol that we use.
Yes.
If you're pregnant in the first 3 months, we will always want to avoid administering ionizing radiation to your fetus. But if it's too necessary, then we will want to protect your fetus before that time, so that you don't radiate the fetus. Because there's always a genetic effect. The ionizing radiation has genetic effect towards the fetus. So we will be asked some questions. Are you pregnant? When was the last monthly period? Because we want to ascertain when was your last monthly period. Then sometimes when maybe if you are doing ultrasound scans, I know some patients have come to the radiology department, they've been told to take enough water to fill their bladder.
Yes.
Definitely, sometimes it's too uncomfortable, but it helps us to visualize the pelvic organs, because you realize ultrasound always, it always magnifies, when it passes through a fluid structure, it magnifies the structure which is around it, through refraction in physics. I know maybe you did physics a long time ago, but at least you understand what refraction is. So those are some of the things you'll be told to take water. Is just because of preparation. Sometimes when you are doing abdominal scan or abdominal examination, we'll tell you to fast for at least 6 to 8 hours, because you want to avoid, sometimes when you feed, there are some, the sheds are going to cause obstruction, and you're not going to be able to look at the structures well. Sometimes when you're doing examination like CT scan and MRI, we'll want to inject you. Whatever injecting is called a contrast. He's so conversant with it, his area of working. So the contrast will just want to, we'll want to inject you intravenously, so that the dye goes into your body and it magnifies the structure. It gives us the function of the organs, so that when you are doing the CT scan or MRI, when you're doing those pictures, we can at least look at the vascularization, the blood flow of those organs. If we are looking at the liver or the kidney or the brain, we want to look at the blood flow. How is the blood flow? When we inject the dye, it gives us a clear picture of what is happening. If there's a tumor, we inject the dye, it gives us a clear picture of the tumor. Is it, does it have a blood flow, or is it not, that is it avascular? Is it vascular or avascular?
All right.
So that's some of the things that you expect. But generally, when you come to the radiology department, what we do mostly, we don't, there are no operations there. Our work is do pictures. The other things that you are going to do is just a conglomeration of making a good picture from your body. Thank you.
All right, we have a few people here online.
Maybe Moses,
yes,
just before the online, it's important for him also to just take cue and add on that, that people come to department with a request form from a referring physician. Now it's that request form now that informs the procedure. Of course, now the procedure is done, and then the results are sent back to the referring physician. So that is, when you want to come to seek these services, maybe you could also get people online who are saying, oh, I've been having this problem, what do I do? No, they must see a referring physician or a clinician who will then send a request for checkup.
Juan Anthony, I want to ask you a question. Sorry, Samuel. And you can feed and your friend. Are there cases of abuse? And if what would cause such as a patient, what would you tell me that is abuse, and how do I address it?
Sure.
And also allow the policy man.
Yeah, it's a good question, and I thank you for that. There are quite cases that this thing can be abused. You realize, away from the X-ray machine that you use, we have other things that we call radioisotopes that are used in nuclear medicine, and it's one of the most upcoming area of practice in radiography and radiology. So these are things that can even be used to even to be used by terrorists. So if you have a rogue person who is in the department, is likely to abuse this and use them to probably sell them and do that. To make sure that we have some cases like terrorism and all those things. So it's something that needs careful consideration, even when you're hiring for the employers. You need to have a person who is well licensed, a person who also is well trained. You need to check the background of the training so that we don't have any cases of abuse. You realize some of these people who want to abuse the profession there are people who are not well trained or something like that. So the background need to be checked very well. The other thing is also the fact that radiation in itself, sometimes patients may not understand what you're doing as a radiographer. So you might do something, our radiographer or a person who is not well qualified might do something knowing that he's jeopardizing the patient life, or like he's repeating an X-ray, or maybe repeating so many of those examinations that are not worth of repeating. So there are some rules and protocols that are supposed to be watched. Things like distances. You realize the effect of radiation and how radiation interacts with you is associated with the distance and some energy sort of the things that are produced by the machine. So this person is supposed to give you the right dose at the right time and for the right purpose. So those are maybe areas that I would want to emphasize, even for the people who are in practice.
Okay.
Yes.
My friend,
Yes.
how can a patient know there has been abuse? And because you're a policy person, I'm sure there are policies that
Yes.
guide, because like you said,
Yes.
these are dangerous, you're dealing with dangerous material. Yeah.
You know, healthcare practice from a health economics point of view is a principal agent issue, whereby the person offering service knows what is to be offered. Patients do not go to medical schools. So patients technically are at a disadvantaged position of knowing what happens to them. So that is the first point. It's technically difficult for patients to know, because the knowledge and practice is vested in the one offering it.
Yes.
But to help our viewers understand abuse, we border on responsiveness.
Okay.
This is on dignity, this is on humility, this is on compassion, this is on professionalism, and those are things that cut across board. When your dignity has been affected, when respect has been violated, sometimes you can ask. But you know, hospital practice is very interesting, because if a gentleman like you walks to a hospital, sickness does not choose.
Yeah.
Neither do you choose who treats you. You will walk into a hospital and you'll get a lady who is the radiographer there.
Yeah.
And maybe they want to do a procedure that you'll have to remove your clothes and expose yourself. What we will say is that not only radiographers, healthcare personnel, during our training, we are given intensive training to empathize and understand patients' dignity. Okay. So much as we are likely to see cases of abuse, we rarely experience. But for patients, how would you know? Anytime you walk into any facility, there is a patient charter. Patient charter, which will always guide you.
Wow.
That this is what you expect, this is what you should not expect.
Wonderful.
So that makes it easy for them to know. But for a patient to actually know that I was given this drug, and sometimes we hear people saying that I was given the wrong drug, it's never as easy as that.
Yeah.
Because there was a time, and just allow me to say this, there was a time we were involved in a labor dispute when we were doing industrial labor issues with other healthcare workers. Then one legislature from one of the county assemblies went to hospital, found one of the relatives or a close friend was being given medicine 1 time a day, given single time. Then the neighbor was given 3 times a day. So this member of county assembly became very tough and said, this is discrimination. Why are you giving my patient one treatment once a day,
And the other one,
not knowing that it's the dosage described and the disease is different?
Yes,
So we'll not go into the depths and say that when you go to hospital, lazima ufanyiwe x-ray. Hapana. The decision for the justification of the procedure lies with the profession, and we'll just like to assure them that we are highly trained with a lot of dignity. We value them so much, because we also get sick.
That's the amazing part.
We also get sick. And we do to people what we want to be done to us.
We are going for a break.
Yeah.
And we are going to turn this conversation into another way. Now, I think it will be good practice to just acknowledge some of our people. We have quite a number of people. We have Sorina Doyo. She's saying you guys are doing a good discussion. We have Senior Mugendi Mwakisa. He's calling somebody here Big Samuel Mburu Karanja. It's big. We have Cliff Oguk, and he said you should have this often. Cliff Oguk, we hear you. We have Geoffrey Mashia saying you guys are doing you are a great panel. Great panel. So
Thank you, Geoffrey.
Those are some of my students. Huh?
Oh, really? So tell all your students to be here. Joy Mbugua, this is awesome team here. We have Lydia Makini and Makena Agola. All these people are watching. And before we go for a break, Bwana Samuel, what is the difference between a radiologist and there's another name we call a radiographer? Because those two names feature a lot.
Yeah, they do.
Thank you so much. I thought the policymaker would have gone on that.
No, I can take the first few, then we
But
can
I
explain.
love the question. It's a good question. It's something that comes out every other time you are in any other discussion, or maybe even some of the medical people who are in the hospitals do not even know the difference. A radiographer, a radiographer is mandated to produce quality images for purpose of diagnosis.
Okay.
So a radiologist, a radiographer can have they have a program, as Bon Anthony had explained. We have a program that run separately from, you can start from a level of diploma going to degree, as Anthony had explained it. So a radiologist is this person who have done medicine and gone to do post-graduate studies on radiology. So that's the main difference. So maybe I could give my policy maker to
Actually, what happens?
Policy makers, you do as you answer. We have actually like 4 minutes,
So 4 minutes.
to go for a break.
Yeah.
As you do that, you know, when you enter a hospital, kila mtu ni daktari.
Daktari.
It's only the women who are called sisters.
In fact, I wanted to address
So
that.
please address that, so that when I walk in, I don't
You know.
call you daktari and you are,
A
because
radiographer.
we need to put those standards.
So number one is that in the hospital setup, there are over around 20 healthcare professionals inside there. Almost 20 healthcare professionals. We call them cadres. We've got the medical officer, we've got the nurse, we've got the clinical officer, we've got the radiographer, we've got the clinical, the physiotherapist,
Pharmacist.
orthopedic, pharmacist. What we hear, surgeon, whatever, those are levels of practice within medical officer. You get it? Now we've got a nurse who goes up to critical. We've got radiographers. Those are, we've got cadres, then we've got levels of practice. The so-called consultants. We've got consultants in all those. We've got a consultant nurse, we've got a consultant physiotherapist, we've got a consultant medical officer. Now the consultant medical officer that partners with us is called a radiologist.
Okay.
You get it?
Okay.
Now we've got also occupational therapists. Like for instance, when you're looking at COVID-19, when patients go in, we had critical care nurse, we get respiratory therapists, physiotherapists who work specifically for those kind of patients. So that is how the continuum of healthcare works.
Okay.
But for the sake of, I think the history of Sister Daktari came in when the Catholics came in. Because the female, the others were, most people who are treating people were male who are doctors, and the others were sister, brother, you know, the sister. So everybody in the hospital from the mission mindset is a sister.
Wow.
So that is how the issue came in. But when we get into the cadre, we've got almost 25 cadres inside there.
Wow.
And radiographer is amongst the cadres.
Wow.
So we all work interdependently to serve the patient. To the eye of the public, sisi wote ni daktari. But sasa ni daktari wa picha. When you go to pharmacy, daktari wa dawa. Ule mwingine, daktari wa nini. But to help the people understand is that we work all to serve the patient. To make sure that when the patient comes in and they walk out, they are well and ready to work.
One word.
Yes.
Mr.
Moody.
Somebody is celebrating you online. Call Nation is saying it's fantastic. This is a fantastic panel. Guess sharp and seasoned. Then he mentions you. You're very sharp. Thank you. One word. Are there other disciplines in radiography, or is just kupiga picha?
No, though. Thank you for that question. Radiography is like when you start at the basic level, you've done bachelors of radiography. You can go to masters, then divert. We have CT radiographer, we have ultrasonographer. I am a sonographer dealing with ultrasound. There is an MRI radiographer. There is nuclear medicine radiographer. So there are other cadres. From the basic level, you just start as a radiographer. You can do so many things, but you can go up the ladder, become you do a specialization.
Okay.
So when you do MRI is magnetic resonance. You do CT radiographer, MRI radiographer, nuclear medicine radiographer. Then you can go up again and become a researcher. That's at the PhD level.
Hold it there. We're going for a break. This is Elevate. Please do not change. This thing is getting better. The panel is being sharpened by the hour. We are coming back. This is Elevate. Keep it there.
There is no town, there is no city, there is no nation without fathers.
They went before us and set the stage of what we see in the gospel today.
It's immediately when I got saved.
Wow.
The Lord placed in my heart passion for souls.
They fought the battles and prepared the way.
They were told this miracle worker is here from Kenya. He has troubled so many churches in Kenya. Football. Be careful. Others said he's a false prophet, but the sick did not listen to that. They needed it.
What did they do that we are not doing?
We believed the word of God that it is true. I believe the word of God that by his stripes I was healed.
Do not fear, for you will not be ashamed.
The gospel then and the gospel now.
God says, do not be dismayed.
We didn't have the technical gospel that people have today. If you believe, bow your head, raise your hand, come forward. No. No. People just stood up and began to repent by themselves.
Wow.
Others crying on the floor, saying, save me, save me, save me.
Oh, Jesus.
Tracing the mantles.
Welcome back. This is Elevate TV Wednesday edition, the morning digest, and we are discussing the matters radiography. And we have quite, let me just pick it up before we get into our discussion. We have quite a number from Kilifi, all the way from Kilifi. People are watching from Kilifi. I think radiographers in the country have just been waiting. All the way from Kilifi, KNH, we have Victoria Kioi, very informative. In fact, she says true. Radiation is dangerous and radiography practice must be regulated. She's watching from Nairobi. Alex Ichela is there. Sami Wamote is following. He's saying, I'm following you guys. We have Premier Imaging Center Nakuru.
A whole hospital. Thank you, Premier.
Premier, asante sana. We have Bonnie Junior Michael. We have Karanja David. We have Bonnie is asking this question. Can there be a link between radiography and forensic? And my friend is going to pick it up. Mary Nyomo is saying this is wonderful. Boniface Nzomo is watching from Nakuru. So you can see from Kilifi all the way. And I'm very glad that you're here. By the way, I'm enjoying myself. I have to say that. Please, is there a link before we go to what I wanted to say?
There is a link, and taking cue from what he spoke about, you asked about what happens when you are radiography. Now, radiography is interesting. Why it's a unique career is because it's not only medical.
Yes.
We've got the medical bit, we've got the industrial, we've got the veterinary.
Wow.
Now, quickly, I'll talk about that, then show you where forensic fits in. The medical bit is what we are discussing, what we primarily do.
Yes.
Then we've got industrial radiography, whereby now for glasses, pipes, in the Kenya pipeline, for them to know where there's a leakage, for them to know whether these glasses have got cracks or tires or tubes, we use what we call industrial radiography. Same technique, but now on non-living things.
Wow.
We check out defaults on them. So that when they sell you a pipe for building and construction, for it to be verified to know that it doesn't have any crack or we call it the integrity. It's done by an industrial radiographer.
Okay.
We've got veterinary radiography. in the Western world, in fact, it's more rewarding than even medical.
Yeah.
You know, you can talk to a human being and tell them, "Toangwo, you know, we want to do this procedure," but how do you handle a cat? So when the cat or the dog or the horse or whatever gets fractured, they're also treated. And that is the bit we call veterinary radiography. We've got our colleagues who work in Kabete Institute of Primate Research, and it's a very rewarding and very expansive career.
Wow.
So we've got industrial, we call it non-destructive testing.
Okay.
Industrial, we've got veterinary and medical. Now in medical, we've got what we call forensic radiography, we've got diagnostic radiography, and sometimes we've got therapeutic, then we've got screening. Now forensic is when we use it for the purposes of medical legal issues.
Okay.
Like a quick example is you heard about in Machakos, there was somebody who was killed, put in a sack, then whenever you hear our government pathologist saying he was hit by a blunt object, these people are taken to a radiology department, then we do a scan and we're able to see he was hit by, that is now the forensic bit for purposes of investigation. So when you study radiography and at postgraduate level, you can major into forensics, whereby now you do studies primarily for that. For instance, cases of rape or road traffic accidents. Road traffic accidents primarily fall under forensics, because there is element of going to court, element of you proving that actually I was hit here, I got this fracture. So there's a way that examination is done, how that procedure is done, so that when it goes to court, the evidence is admissible. So it's a whole continuum of care, and that's why the difference between radiology and radiography, we share very little, but the line is very thin but very clear.
Wow.
It's very thin but very clear. So the whole continuum, the whole continuum of practice is very interesting.
Wow.
Yeah.
Let me tell you, what you've done, you've enlightened me. I'm seriously enlightened. And you know what I'm just thinking in my mind as he's talking? The importance of this practice in in humanity.
Yes.
The importance, because if it cuts across like that, that means then if you remove it,
the house you stay must have been done industrial radiography to ensure that it's safe. Before we build there, a geologist has to know whether there is emission of radiation or not.
Yes.
So it's an industrial radiographer who comes to find out what is the status here.
Wow.
Then the materials comes is from that guy. Then when you come there and you exchange physical whatever, you come to Moody and he's able to tell you the growth of your fetus.
Because you need to understand.
So
in some of these departments in government, let me put a case example like KEBS. KEBS is a government organization that is mandated to check on standards.
Yes.
You'll find radiography takes part in such departments, because you need to, for you to verify some of these items, you just need radiography to maintain the standards and quality. So even before some of these things are used to the human being or maybe used by human beings, you really need to check the standard using radiography.
Yes. You know, I'm coming to that because I know that one is going to become one of your, that's your place. You know, I don't want to move, but I have to move.
No problem.
You know, I said you're a wordsmith and somebody has accepted. You say there's a very thin line, but very clear. Very clear. Very. Now, I want us to shift this into the society of, radiographers in Kenya. And I don't know, maybe SG, you are the SG now. I have to address you in your official titles.
What's the title,
The SG, and what is it? And please, in few, because we don't have all the time, we are going to just ask some questions and please answer that. What is it all about? And why is it not named like the others, other organizations? Radiologists of Kenya.
Thank you so much for that question. Let me first of all start by we named the society starting by the Article 3, the Society of Radiography in Kenya. It's so specific and so unique. So the other thing is it's a society that is mandated to take care of training and practice of radiography in Kenya. We have affiliations to other bodies like the ISRT. It's an international body that bring together all radiographers in the world. We have affiliation to Kenya Nuclear Regulatory Authority.
Wow.
We have affiliation to Ministry of Health, the whole the MOH. We have affiliation to Kenya Association of Radiologists as well. They are also our partners. We work together because the way he's saying this.
Also, there's a Kenya Association, and then you are the association.
Yes.
Wow.
And our the association. So that's a good thing to mention.
I have to mention that.
So we have all these affiliation, and these are bound to just maintain the quality of training and practice in Kenya.
Maybe just to add on what he has said, before you practice as a radiographer, you have to be licensed.
Okay.
You don't just leave the college or campus and start practicing. So you have to be licensed, and the body that is mandated by the government to license us is Kenya Nuclear Regulatory Authority.
Okay.
SCANDRA.
Let me ask this. Well, I come back to you.
Yes,
You are the former president.
Yes.
By the way, you know, presidents like Mao suits. These Mao suits, I'm going to get me one. Mao suits. You know, when you see men in Mao suits, it's a power statement.
It's a power statement.
It's a power statement.
I never knew. I'm learning.
No, it's true. You check.
Yeah.
Check them. Now, the association, the way it's, because you are a former president.
Yes.
What is it? Number one, is it mandatory for all radiographers to be in it? And then he talked about the association being for practice and training.
Yeah.
Is there a policy arm that works with government, or do you have any affiliation where you bring policy into government?
Thank you. The Society of Radiography in Kenya is registered under the Societies Act.
Okay.
The uniqueness of radiography as a field gives us very unique operating platform. Our affiliation to the International Society of Radiographers and Radiologic Technology, by extension to IE and WHO, gives us an extended mandate.
Wow.
In view of how do you come into practice, as he said, you have to come in. Then the professionals, we the peers, you know, in healthcare we've got what we call peer review. That's why we've got Kenya Medical Association, Clinical Officers Association, National Nurse Association. It's a peer review because it's we peers, because remember I told you, patients do not know anything about healthcare.
Yes.
It's me that I know you've done the wrong thing. So it's a peer reviewed. So as peers, we subscribe to the Society of Radiography in Kenya. If you don't subscribe to that, and it's a constitutional requirement,
wow,
that every professional person in this country must be a member of a professional body.
Yeah.
You'll always see that, because then that is when you can be questioned as a peer. That is when you remember when Waziri Kimunya at one time he said, I'm a member of the Kenya Accounting, you know, when he was being asked. So you need to be a member of a professional association, and that's where the Society of Radiography comes very prime. So you become a member of the professional association, and then all documents technically, you know, we work in partnership with government, like the training guidelines, the code of ethics, which we worked in partnership with the Ethics and Integrity Commission, the training guidelines. We worked in partnership with the government. It's our document, but we give it the government, you know, the government has the machinery to legalize. But something that I like to say on regulation, Kenya Nuclear Regulatory Authority is a government agency. They deal with one arm, possession of iron, of radiation and other related materials. But training and practice, and this is important for us to mention, that Honorable Sabina Chege through the Health Committee has taken up that cue, and she's done tremendous work. We know she's watching. She might not comment, but we know she's watching. Her constituents are watching, and we are telling them, you've got a gem in that lady who is the health committee chair. Because she's taken up, she understands the issue of regulation and practice of radiography, and she's taken a bill that is at the second level now, and we expect it now to have second reading, and very soon it will be ascended by the president to make it now law, to ensure that the Society of Radiography works with a government agency that looks at training and practice specifically. So to answer your question on whether, how do we work with the government, how do we mitigate in through, government works with us as partnership.
Okay.
the way government partners with all non-state actors. Even for Elevate TV and many other religious organizations, there is no an arm in government called church or anything. But when they need anything on the guidance of religious, they talk to the Muslim Council, they talk to the Interfaith Council, and those institutions are mandated by their professionals, which carry the heavy reason to share with the government. So that is the relationship.
Wow, that's amazing. It's, you know, it's quite something. The relationship between government and many associations I've always had complaints, but you are celebrating, and we want to thank Honorable Sabina on your behalf. Yes, Bana SG.
Thank you so much, Moses. I want to emphasize on what my colleague has said. It is actually mandatory for anybody to be at a professional association. There are things that are called professional developments. These are the only, the associations are the only organization and body that have been mandated by the government to offer this. And these are usually actually in terms of two things. They are usually in terms of CPD points and in terms of CME points. Okay. So they are only mandated, and the Ministry of Health has given a clear guideline that even now the policy that has been laid is that you must have attained a certain standard of some form of professional development for you to practice. Let me give you a case example. A person goes to school, practice for 3 years, then he decides, no, let me go to business and do something in paperwork. In selling papers in town. Then he comes back. This person need to be rechecked. How long have you been out? Do you need some training? Do you need some examinations? Do you need all these things? All these questions need to be asked.
Are you legit?
Are you legit?
Because we are dealing with human life. You know, that is the sensitiveness of this matter. It's human life.
I can see it.
And a small error, we're losing somebody.
Yeah.
So as my colleague has said, we really look forward to this regulation. Let me give you another thing. Our profession is very dynamic, and the good thing is that we relate with so many people, and it's also fun to do it. One moment I'm relating with a neurosurgeon. He's in our office. We are discussing a case of neuro, and the next moment you're relating with a cardiologist. You're discussing a case of cardiology. So this has happened, and it has made us look like we are already regulated. Like people would see like this is a very big profession. That is look like is already regulated, but the fact that sometimes you can be bigger by your name. You can be bigger than your name. So there has been that gap, and we thank Mheshimiwa Sabina for taking that chance to make sure that this gap is addressed. Actually, the specificity of it, we have been addressed somewhere else, but not in that manner that we would want the specificity be done. Okay. Thank you. So
let me ask you, Mr. SG. When you talk about regulation, is the profession regulated? And then, because you see that the regulation, because every industry should be regulated.
Exactly.
So to ensure safety, to ensure responsibility, you know, are you regulated?
I would want to say that the profession has been partially regulated.
Take that water.
Thank you so much. I would say it is a partial regulation, and this, I mean, like so many things have not been addressed, and so that's why we are calling now that the fact we have a full bill that is in Parliament.
Oh, wow!
It's in Parliament, second reading.
The bill is at second reading. So when I say partial regulation, I would mean like you see we practice in building with machines and all those things. Those machines are well regulated. They are well licensed. But the practice itself, the professionals themselves,
yes,
the training itself is what we are addressing here.
Okay.
So that is what the gap has been.
So the bill is going to address all that.
Yes.
And we need to ask Mheshimiwa and his colleagues and her colleagues to please pass it.
Yes. Actually, they are passing it. It's just an issue because they have gone for recess. Okay. But we've had stakeholders engagement, and everybody agrees that is very key.
Okay.
Because it's a matter of life and death.
Yeah, I can see it. This is a serious matter. You know, I think we don't see the seriousness of it because maybe it's not spoken of like this. In fact, for me, I'm exposed, to be honest.
Another thing maybe is because we are dealing with things which cannot be seen, cannot be heard, cannot be felt, cannot be smelled. So sometimes people don't know that they exist. So people, in quotes, think that they are safe. But because, as he says, this is a serious thing, something which cannot be seen, but the effect can be felt, even to the generation, as I talk about genetic interference, then this must be a serious matter.
You know, First John says, those things which we have handled, those things which we have heard, which we have seen, these are the things we tell you.
Yes, absolutely.
Those are the things we tell you.
Yeah.
Now, we've just, this is the World Radiography Week,
yes.
We had it celebrated on Monday.
Yeah.
What are we celebrating?
The World Radiography Week is an interesting time. You know, in 8th November 1895, 1895.
Okay,
Conrad,
1895.
1895.
Conrad Rontgen, a German physicist, did the discovery of X-rays.
Wow.
Then, you know, the follow-up of Becquerel and the Marie Curie in the discovery of radioactivity and subsequent follow-up. Those are almost 100 years ago. And we commemorate it every 8th of November and the week that precedes. This year, we are talking about radiography, the role of a radiographer in a pandemic.
Okay, so that's the theme for this
That's
year.
the theme, and it is usually set by the International Society of Radiographers and Radiologic Technologists. It's circulated all over. It's a theme that is set in partnership with the WHO, International Labour Organization, and International Atomic Energy Agency, so that we come and share what have we done during this pandemic, to just demonstrate our support. And at that time, also would like to say, for all our colleagues who have done exemplary work, staying on work when we are asked people to stay at home, those people are heroes. You might not be, you might not be acknowledged, you might not get the accolades, but in our hearts we really appreciate the work they have done.
Moses, I would want to take this chance even to recognize during this pandemic that we had, we had also loss of life.
Yeah.
Okay.
So, and part of our membership was touched. So we really want to empathize with the families of those who are touched on by the pandemic. I know quite, I could mention the number, but maybe just some of them were even instrumental in the society.
Wow.
I remember some of the members, we had even scheduled a meeting, and then you hear that the person has gone off, and so we really empathize with those families, and we pray that God will give them strength. The other thing the pandemic brought was the change of even lifestyle. We had even change of protocols in our departments. So you're used to do this, and you have to go a long way, even just to protect yourself and protect the patient. I know there has also been mental strain even in our membership.
Yes.
I want to thank membership and tell them that take heart, and we are still in the forefront. The theme was very coined, the fact that it was the role of a radiographer in a pandemic. It did not specify that it is COVID-19. So we cannot close at it, and we say that it's yet over. Another pandemic can come on. So we just need to be prepared as professionals. So thank you so much.
So Moses, one thing you need to realize what he has just said, during the pandemic like COVID-19, we are protecting ourselves from the virus. But again, you know, even as radiographers, we always protect ourselves from the radiation. So actually, we are doing double protection.
Wow.
You are protecting yourself from the virus, and you are also protecting yourself from the ionizing radiation.
We can't, I can't read all these comments. There are so many. We have so many people there. Cliff Oguk has written something major saying, I believe radiography is an important aspect in medicine, just like surgery, and I wish I can have this quite often for the purpose of educating the public. And I agree with him, because we need this civic education.
Yes.
We call it health literacy.
Health literacy, yeah, that's the word. I tell you, you are a wordsmith. Very true. We have this, Boniface Nzomo calls it the eye of medicine. He says it's the eye of medicine. Thiga, saying, good job.
Oh, that's Ambrose.
Thiga, he's saying, Ithiga. And then we have Jevas Kanyanya.
Yeah, that's our current president.
He's a president.
He's in Ghana.
Para Kenyanya.
He's watching from Accra, Ghana.
Oh, Hello, my friend. All right. God bless you, sir. Then Kevin, tell Mr. President we'll host him when he comes back with his entourage. Kevin Ahenda Otieno, many of us didn't know what radiography was all about before we joined the fraternity, but we are proud to have, we are proud of the journey, and this is very, very interesting. We have finally Nelly Rono says, KU Referral Hospital has a cyclotron, and it can be a potential risk. Okay. If professionally is not regulated, maybe that one should be taken over by the hospital. And Dominic Kimeli, there is Titus Simi, with all these people are watching, and somebody is saying my lecture. I hope they have remitted their assignment. They
are good students. They are good guys. I hope but just to pick something there's something that Nelly was mentioning about cyclotron. Nelly is a good friend of ours. And what she's saying is that Kenyatta University Teaching and Research Hospital are doing a marvelous job. They have brought in the molecular imaging aspect.
Wow.
And that is the cyclotron, PET CT, and it's just an emphasis on the risk that we need to regulate these things.
Okay.
Yeah.
The regulation is key here.
Yes,
because actually, like you say, it's a matter of life and death.
It's a matter of life and death.
It's a matter of life and death. Let me ask you, just the society. You know, it's good, like you said, is every professional should join or should belong to a professional body.
Yes.
You know, what are the benefits of joining the society, this society, to two people? One, to the professional, and the benefit, two, to the patient. Anyone can answer.
No. The SG is the custodian of the instrument. Is the custodian of the instrument.
Then, thank you. When I see my senior say, he's still my senior. When I see him bestow the powers, I'm now courageous to go ahead. So, our main focus is the primary role of any profession is the results. We could start with the patient.
Yes.
So, the benefit to the patient is, as this has also been mentioned earlier, the fact that we have a platform where we could have a peer review, whereby we could exchange knowledge, we could sharpen our knowledge. Let me just tell you, we have just come out of our scientific conference, which was attended by 150 radiographers in Mombasa. During the conference, we had what we would call abstracts, and they are most of them coming from a research point of view. Like, this is what we do in our department, this is the cases that we have seen, this is how we tackled them, and this is how you can avoid problems, this is how you can make the diagnosis right. So the fact that the society is there and forming such things like a platform like RASCO, where people exchange knowledge, it gives a better chance to the patient to get the best of the best.
And of course.
So eventually the society just aims to give the patient the quality work that is coming from the professionals, based on the exchange of knowledge, based on the even check. Sometimes
we need that element where we can check. You can
check and balance.
Yes.
Check.
Because of time, allow me to cut you and ask you another question that is important. Yes. The society, do they have a disciplinary committee or the disciplinary arm?
Yes. Thank you so much for that question. Actually, I wanted to tell you how it is. Maybe that could give me, I hope you give me a little bit of time.
Less than 5 minutes. So my director is saying I have less than 5.
The society works with what we would call committees. So we have a pillar committee. Pillar committees deals with legal issues and discipline issues. So we are likely to even intervene externally and internally. If it's our member who has issues, we come in. We look at, is this an issue that would need probably training? Is it an issue that would need intervention in terms of, dialogue? Is it an issue that need court case? Is it an issue that need even, termination, even expulsion? You know, so that are things that works with that committee.
On that same, on the same, because I have to rush you. Allow me. On the same, if it's not only disciplinary. it should also, do you have an arm where you speak on behalf of your members? Because some of them wanadhulumiwa.
Yes. That's why I was going to through various things.
Hiyo rais
and
angejibu.
No, the SG is here, but just quickly, we have got disciplinary committee, and the society is also a welfare program.
Great.
So we champion.
Yes.
You remember I mentioned about labor issues? So we champion the interests of our members. You know, the way we champion issues of our members is through professionalism. So we champion them to be professionals.
All right.
And like what we are doing here, we are advocating for them.
Yes, you are doing a great job.
Yes,
And actually everybody is accepting. All these people are saying that. We don't have more time. I want to give you each a parting shot, which is less than a minute.
Yes.
Call out your members, call out their patients, and give a parting shot. Let me begin from the
Moody or
Moody. No, let me begin from the far right as you come, because I'll close.
Thank you. I mean, this is good, and we'd like to say this to our colleagues. This is what we remind ourselves every day, that when you treat a disease, you lose.
Look at that camera and tell them.
Which
that.
one? That
like
one. You know, we've not gotten into this. Okay,
Repeat
fine.
the same statement. When you treat a patient,
When you treat a disease, you lose. When you treat a patient, you win, no matter how the outcome is.
Wow.
And that is the cue that all professional colleagues do. To the legislators and other people who are outside there, we would like to talk to our colleagues that speak to your legislature. Tell them that we need to regulate this art and science that gives us a chance to treat and diagnose diseases in the human body.
Well said. Well said. My friend Moody, look at that camera. Just one word, 2 words, and we are done.
Okay, so thank you. And my colleagues, as you listen to what we are saying, first of all, I want to thank you so much for just having time to come and follow us up, even as we speak on your behalf matters regarding the profession. I would like to applaud you for the good work that you're doing, because as we understand, as you talk about imaging, if we don't diagnose the disease correctly, then as I want to add to what our former president has said, you lose the patient, because the treatment that you're going to be given is not going to work. So it starts from you and me. So as you work, as you do your work, kindly do it diligently. And we always pray for you that we are going to do a better job, and always for the betterment of the patient that we are mandated to take care of. Thank you.
On SG, you hear Moody praise for his colleagues. So please give me a parting shot.
Thank you so much, our viewers and our members watching online. It could not have been possible without you guys. We really thank you. We also thank Elevate TV for this chance to speak to the world. I know we are speaking to the world, not even Kenya. So one thing I would want to emphasize, that, and it has been in my mind, has always been my core interest, is the issue of regulation and the practice. So I would want to say, for the legislatures and the Committee of Healthcare in Parliament, kindly help us get through this journey of regulation. And also our members, as we go through this journey, kindly support us where you can, and support the leadership. I know you have been very instrumental in supporting the leadership, and we want to thank you for that. So, and even in your practice, kindly, actually I only have one word, not more than that, quality work.
Wow, I could not say it better than they have done. And I think for me, I really appreciate you, former President Moody and Samuel. I'm really grateful that you came. Let me tell you this, and hear it from me. We are willing to have a sitting again.
Thank you.
We have
Thank
not
you so
finished.
much.
It's our pleasure always.
We have not finished. Just know that. Let's sit down. Let's agree on when and how it's going to happen. And let's sit down. We need this literacy, like you say.
Bwana Moses, before you close, I know we have brought the issue of the profession and career line. I would want you probably, and maybe your management, to consider an academia sort of thing, something that probably we can come and discuss, something that people ask, maybe a specific disease and a specific way of
Like a
diagnosis.
professional week.
I'm telling you, we have not finished.
Yes.
What we are going to do, we are going to sit down and agree on what to do next.
Yeah, okay.
I think we need to do more.
Yeah, okay.
From what I've heard, we literally have to do more and bring a lot of literacy out here, be able to talk about this matter. And you're always welcome. This is your home. All right?
Thank you.
That's all we could do. This is Elevate Television. I've been your host, Moses Mirure, with all this great panel, very sharp, very knowledgeable, and very tight. You know, we have just had a mind-boggling experience today, just knowing something I thought I really did not know. God bless you. Have a great day. Remember, keep it elevate, advancing kingdom lifestyle. See you.
Thank you.